They're so sweet. Those are huge.
Okay. First item on the agenda, we're going to approve previous minutes.
Motion.
Mr. Clay, motion. Second, Mr. Camiso, all in favor?
Aye.
Opposed? Passes unanimously. Okay, on to current business. Number one on the agenda, Commissioner McClave, amending resolution number 182 for 2015 regarding abuse, neglect, and domestic violence of women over 50.
Yes, good evening, thank you. This is to renew and extend an MOU that we currently have with Senior Services of Albany. It's a no cost to the county. We offer an employee to participate in trainings identifying domestic abuse in people over 50. And we've trained the different police departments and other provider organizations on how to identify and work with people who are potential victims of domestic violence. So this was a 3-year grant that they had, and they got an extension for a year till next fall. So we're asked to continue to participate on this grant with Senior Services of Albany.
Great. Any questions from the committee? Hearing none, motion to approve. Ms. Lockhart, second, Mr. Bullock, all in favor?
Aye.
Opposed? Passed unanimous. Okay, we're going to skip ahead to number 7. Number 7, item 7 on the agenda, authorizing an agreement with New York State Industries for the Disabled regarding ancillary laundry services for eligible individuals in the EISEP program.
Yes, this is to develop into a contract with New York State Industries for the Disabled, who will provide laundry, who will subcontract with Plaza Linens to provide laundry services for our clients enrolled in the expanded in-home services for the elderly program. This is kind of this is an ancillary service that we can provide for our clients that are enrolled in ISIP. And it's a same as ISIP, it's a 47% county reimbursed, 59%, I'm sorry, 47% state reimbursed, 53% county cost for this program. It's up to $100,000. We have 221 clients enrolled in the ISIP program, 103 are receiving the laundry services, so that gives you an idea of the usage for that.
Okay, thank you. Are there any questions from the committee? Mr. Reinhardt?
I have a question. When I look at the first couple of pages where you talk about is there a fiscal impact, you say there's a fiscal impact, and presumably that's the county budget that's being spent on this, but in the narrative you talk about how this actually saves money because it keeps people from going into nursing homes as part of what the ESIP program does. I know this is a difficult question, but can you quantify that benefit?
Well, we have 221 people receiving ISIP. These are people who are not eligible for Medicaid in the community, but if they went into a nursing home, they would most likely be eligible for Medicaid and using Medicaid to pay for their nursing home care. So yes, 221 people are in need of services, home care services and other support services, to the point where, we can't say that every one of them would be eligible for a nursing home. But certainly some of them would be eligible for a nursing home and would go into a nursing home without the ISIP program. And this delays their entry also.
Right. Do you have any kind of a per capita statistic on when you do the home care, what it tends to cost per capita versus when they go into nursing home, what it tends to cost per capita on an annual basis or some statistic like that?
220 people, breakdown of what services provided.
Yeah, I mean, we could tell you how much we're spending on home care through the ISIP program. The ISIP program, which is coming next, actually, is up to $1.492 million program. And everybody has different number of hours of home care, so each person would have a different cost. But I can tell you the total number of home care hours we're providing and then the cost for that, for Albany County.
I often read that it does save money, but I've never seen it expressed, this is what home care typically costs per client, this is what the nursing home costs per client. It would be nice to see kind of how those numbers compare.
Yeah, I can-
If there was a way to.
Put something together, and you can probably tell how much the nursing home gets for Medicaid reimbursement for Albany County anyway. Yeah, Albany County Nursing Home. We know how much that, is costing.
Okay, Ms. Lockhart?
Thank you.
It's thousands.
These individuals that receive this, they wouldn't be at the level of skilled nursing care, right? Or do they receive?
Not necessarily, no.
To get into a nursing home, you need to
Yes,
be meeting
that's why I'm
eligibility.
saying,
So it's
right,
kind of hopefully delaying
Yes.
them becoming to that level.
yeah, I mean, usually,
In place of.
people in ISIP
Right.
aren't really high intensity with nursing care at home. This is more for housekeeping, bathing,
Right.
The laundry services.
They probably wouldn't be eligible for a nursing home at
errands.
this stage.
Some of them may be, but most of them probably aren't quite there yet.
Yeah.
Any other questions from the committee?
It's hard to compare it.
A motion to approve? Motion second. All in favor? Opposed? Passed unanimous. Okay, moving on to number 8 on the agenda, authorizing agreements regarding the expanded in-home services for the elderly program, ISIP.
Yeah, so this is requesting approval to enter into contracts with the home care agencies who provide the home care services for our ISIP enrolled clients. And so they receive a care plan, and we arrange for the home care services based on what that care plan and assessment says that their needs are. So this is, as I said, a 1.492 million up to program with a state a reimbursement of 47%, a county cost of 53%. And 221 people are enrolled in this program at this time. And all of these providers are New York State approved provider agencies. And we contract with any eligible and willing providers in the county, to serve the county.
Thank you. Ms. Lockhart?
Any new providers added this year, or any that we didn't
Yes,
use?
there are, but I don't know offhand, I'll get that to you.
Anybody that we refused?
No, if they are New York State certified provider, we contract with them. New York State does that
Oh, okay, that's right. that's right.
authorization, so
Right.
if
We
they
don't
pass
have
New York
choice.
State, we're assuming they're okay.
Right.
Any other
Thank you.
questions from the committee? Hearing none, motion to approve.
Motion.
Mr. Clay, second. Mr. Reinhardt, all in favor? Opposed? Passed unanimous. Thank you, Commissioner
Thanks.
Clay. Okay, now we're going to go to number 2 on the agenda, authorizing an agreement with the New York State Department of Health Upstate regarding the designation of Children's Health Home of Upstate New York as the home health entity. Commissioner Hagan?
Yes, good evening, everyone. The department requests authorization to enter into contract with the New York State designated health home entity, CHUNY, which is the Children's Health Home of Upstate New York. In 2017, Targeted Case Management Services transitioned into Children's Health Homes, and our Children's Mental Health Clinic Targeted Case Management team transitioned into being care management, a care management agency. And so with that transition, this allows us to continue to provide care management services as a downstream provider for CHUNY, and being able to get reimbursement for those Medicaid services that are applicable under our care management agency. Since we have established this role, we have seen an increase in revenue, with 2018 seeing a revenue of $521,000 generated for the Children's Mental Health Clinic, and we anticipate being able to continue to have revenue level established at that, if not increased based on state planned amendment services that will be becoming part of the Children's Health Home in 2019.
Thank you. Any questions from the committee? Hearing none, motion to approve. Mr. Camiso, second Mr. Clay, all in favor?
Aye.
Opposed? Passed unanimous. Number 3 on the agenda, authorizing the acceptance of grant funding and agreements regarding the Child Right Safe Harbor Initiative and amending the 2019 Department for Children, Youth, and Families budget.
Yes. So our Safe Harbor Initiative is a program that is geared at having awareness and education as it pertains to trafficking, sexual and labor trafficking of youth. This is a program that we've received funding over the last 5 years from the New York State Office of Children and Family Services. With the funding, we've been able to subcontract with St. Anne's, who has facilitated outreach services for us, as well as a subcontract with crime victims, which is able to facilitate those hours between 4:30 and 8:30 when our Safe Harbor Coordinator is not on duty, if you will, that we're still able to have those overnight hours covered in case someone does show up, whether at the hospital or law enforcement, as a victim of trafficking. If you notice, the funding has gone down over the years. That's actually not reflective of the services. It's just how the grant is. Each subsequent year, it has gone down 15%. We have been ensuring that even with the decreased funding, we're building in sustainability, incorporating the Safe Harbor program into our Child Advocacy Center so that we'll continue to be able to provide the services for these victims or potential victims of trafficking, even with the decreased funding.
Thank you. Are there any questions from the committee?
Motion.
Motion to approve. Ms. Lockhart, second. Mr. Camiso, all in favor?
Aye.
Opposed? Passed unanimous. Number 4 on the agenda, authorizing acceptance of grant funding and the submission of a supervision and treatment services program for juveniles to the New York State Office of Children and Family Services.
Yes, this is our Supervision and Treatment Services for Juvenile Program, otherwise known as STSJP. And so it's a plan that is submitted annually outlining the programs and services for those youth that interface with the juvenile justice system. Under our plan, we fund the Juvenile Reporting and Family Center through LaSalle, as well as the Juvenile Accountability Board, as well as other programs and services, with the goal of being able to have community-based services for those youth that are interfacing with the juvenile justice system, with the hope of them not further penetrating and being remanded to detention and or placement.
Thank you. Are there any questions from the committee? Hearing none, motion to approve. Mr. Clay, second. Mr. Bullock, all in favor?
Aye.
Opposed? Passed unanimous. Okay, number 5 on the agenda, authorizing an agreement with the Research Foundation for the State University of New York regarding the Juvenile Detention Alternatives Initiative.
Yes, so in conjunction with the STSJP funding, there is additional funding provided through New York State Office of Children and Family Services for JDI, or the Juvenile Detention Alternatives Initiative. And so they work in conjunction with each other, in that with this contract with SUNY, we're able to have someone to provide the research and the data, and so really being able to track the outcomes based on the programs that we are implementing under the STSJP plan.
Thank you. So the county executive mentioned in his State of the County that, I think he called it, we're moving towards a non-detention for juveniles program. Does this have anything to do with that? Or do you have any information on that?
We have not had a meeting as yet. There is one that is coming up actually tomorrow, but certainly this would lend itself to it in terms of looking at the programs that we have implemented and how those programs can help to get to, that goal of having zero detention. So, and certainly these programs specifically speak to that. So it would certainly be incorporated into that.
And what, What are the alternatives that would be potentially used instead of detention for juveniles?
We're looking at some of the services that we already have. So the Juvenile Family Reporting Center, or also known as the ERC, the Accountability Board, looking at having graduated incentives. So really looking at some intensive, high intensive and low intensive programs and services, really again with the goal of hopefully mitigating further penetration into the juvenile justice system.
Okay, thank you. Mr. Reinhardt?
I don't know if you heard my question in the earlier committee meeting, but it's a similar question. When I looked at the materials here, and there was a lot of good information actually. I don't recall seeing a kind of a cost benefit, or how does the cost of, when the juveniles go into the detention mode as opposed to the outcomes you're looking for here, does it cost more? Is there a cost savings of doing it this way with all of those numbers that are, very positive, showing declining charts, all the graphs and all of that? That's all kind of that's all personal good news, right? Good news for the individuals involved. Is there a cost metric that shows how either the county and or other governmental bodies are saving money as this program succeeds by keeping people out of youth detention and perhaps ultimately jail?
Okay, so I can give you a general statement and then can certainly provide more specifics that could be provided after this meeting. But I will say for our non-secure detention, we have a contract that is just shy of $1 million that in regards to addressing that versus when you see a program that is $172,000 that is able to serve over 100 youth in regards to not further penetrating into the system. When we look at some of our placement agencies in terms of the cost per day, we're talking about upwards of, sometimes with some of these agencies, depending on the complexities of the behaviors of the youth, we're talking about some of these are 400 plus per diem per day for a youth that is in placement anywhere from 6 to 8 months to a year, depending again on how long they're ordered into placement and how they're progressing with it. So that's just a general overview just in terms of some of the costs, but can certainly provide more specifics in terms of what is the cost per child in terms of this program versus what we're looking at when a child goes into detention for any amount of time, and certainly when they go into placement, because that's definitely a much more significant cost.
So that was a good detailed answer, but basically you're going to save money if you can keep people out of the detention system.
Absolutely,
Yeah.
absolutely. Not to mention, again, the research shows that the further that youth go into the juvenile justice system, the outcomes aren't good for them
Right.
as they go further. So, yes, there is a cost benefit savings, but there's also just the quality of life and hoping to, prevent that as well.
Thank you. Are there any other questions from the committee? Motion to approve. Mr. Clay, second. Mr. Reinhardt, all in favor?
Aye.
Opposed? Passed unanimous. Okay. Last item is number 6, authorizing agreements regarding the Children's Advocacy Center and amending the 2019 Department for Children, Youth, and Families budget.
Yes, so our Children's Advocacy Center is located at 260 South Pearl, where our multidisciplinary team is located, and this is really a mechanism in order to address reports of sexual abuse as well as severe physical abuse. The idea of the Children's Advocacy Center is to minimize the trauma to those children that have already been traumatized. So it allows for a multidisciplinary team, which is comprised of CPS, law enforcement, the district attorney, hospitals, various entities that would be involved in a case like this, to be able to come together and to really have a coordinated approach, whereas anyone that has been a victim is not having to go through multiple interviews, further heightening the trauma, and really just being able to provide an opportunity to work collaboratively and coordinate in coordination, again, to address the concerns without heightening the trauma that has already been suffered.
Thank you. Are there any questions from the committee? Hearing none, motion to approve. Mr. Bolick, second. Mr. Reinhardt, all in favor?
Aye.
Opposed? Passed unanimous.
Thank you.
Thank you, Commissioner. Can I get a motion to adjourn? Mr. Reinhardt, second Mr. Clay, all in favor? Opposed? Meeting is adjourned.